Flu season is certainly making its presence felt here in Maryland, but is it the flu or something else that's making your child sick? We are now entering the height of the cold and flu season, which doctors say started a little early this year.
And the CDC has issued a warning reminding parents that children are especially at risk for flu, but also for other seasonal viruses that can mimic the flu symptoms. 11 News reporter Lowell Melzer joins us live from MedStar Union Memorial Hospital in North Baltimore with more on that. Lowell.
Yeah, good evening. We've all seen the frightening headlines that more than 20 children have died from the flu around the U.S. this year. But the CDC wants parents to know that there are other viruses out there that are just as dangerous or even more dangerous. Now, doctors tell us with this being said, there's no reason to panic, just parents need to be aware.
Everyone's worried about the flu. For some reason, I think partially because of all the hype.
Dr. Scott Krugman, chair of pediatrics for MedStar Franklin Square and president of the Maryland chapter of the American Pediatric Society, is trying to calm parents' nerves about this year's flu epidemic.
Not every child with a fever and a cough and a runny nose has the flu. We're seeing a bunch of other viruses going around.
According to the CDC, RSV, or respiratory syncytial virus, is one of those. It's a common virus contracted by almost all babies by their second birthday. It's often mistaken for a cold, but is the leading cause of infant hospitalization and more than 8 times more infant deaths each year than the flu.
That is probably, for the young infants, much worse than the flu. Lots of kids in the hospital, lots of kids wheezing, lots of mucus, but in your average 4 or 5-year-old, it's a bad cough, a runny nose, and a fever, which can seem a lot like the flu.
The CDC and doctors say for the most part, a majority of kids will ride it out and be fine, no matter what the illness. It's children with underlying conditions like asthma that need special attention. The best thing parents can do is educate themselves about various illnesses out there by talking to their kids' doctors and to know when it's a real emergency.
If your child's illness is not following that course, if they're not drinking, if they're looking like they're getting dehydrated, if the fever's going on for 4 or 5 days instead of just 2 or 3 days, if you just feel like your child's not acting right or something looks wrong, those are signs that you need to seek medical attention.
Now, doctors say to call your pediatrician first if you think something is wrong with your child rather than bringing them in. The doctor over the phone can then determine if they need a flu test or not, because the problem is if you have a rush of people going to the doctor's office, that's actually one of the best places to catch the flu or some other virus. We're live in North Baltimore tonight. I'm Lowell Melzer, WBAL TV 11 News.